Hi everyone, welcome back to another question and answer time with Dr. Drossman. Today we're going to do another demonstration. I think those tend to go pretty well when we demonstrate different communication skills or different ways to talk with your patient. Today we're talking about the brain-gut axis and what that is. So we're going to demonstrate to you today how a clinician might explain that to a patient, and hopefully you patients who are watching will get a better idea of what is happening inside of your body. So Dr. Drossman, are you ready?
Yeah, and I just want to add that these days the brain-gut axis has become a very dominant theme in understanding the disorders of gut-brain interaction. So your patients are going to ask you about it, and I thought we could demonstrate that for you.
Okay.
So
I'll put on my patient hat.
I'll keep my doctor hat.
Okay. Well, you're wearing the white coat, so you're good.
So Johanna, looks like from the evaluation you have irritable bowel syndrome, and I want to talk more about it. I don't know if you have any questions about it at this point.
I do have quite a few questions. So I guess first, I've done a little bit of reading on my own at home too, and I'm kind of wondering, does IBS have anything to do with this brain-gut axis that I keep hearing about?
Yeah, that's a good question. Yes, it does, and I think these days we are understanding these disorders of gut-brain interaction or functional GI disorders as a dysregulation of the system between the brain and the gut. Now, the brain and the gut are hardwired, and I want to show you some diagrams. Okay. So, well, this is an embryo. And what happens in the embryo is that there begins to be formed the nervous system, which is shown in yellow, which becomes the brain and the spinal cord, and pink is the endoderm, which becomes the GI tract. And if you cut this on the side, you're seeing this endoderm, this notochord, or the neural crest. And these little tiny yellow things are nerves that populate down into the pink. And what that does is it creates a nervous system in the GI tract. We call that the enteric nervous system. Now these two organ systems are now hardwired connected, that the nerves are connected through the spinal cord in the adult. And to give you an example, if you were walking down the street and someone got hit in by a car and they get thrown to the ground, you may, because of the stress of that, throw up. Or you could be running a race, and when you're focused on the race, you might sprain your ankle and not feel the pain until after the race. In fact, in World War II, they did some studies in the Anzio beachhead in Europe, and a psychologist named Melzack examined the soldiers who were wounded in battle, and they had no pain. Now, why do you think that was?
Because they were so focused on what was going on.
Afraid of dying, had to get back to the hospital. When they got back to the hospital, they got the pain. So there was no morphine requirement when they were on the beachhead.
Wow.
So that's what we're talking about, and let's bring it to the present period. And this is a photograph of the gut and the brain, and what you're seeing here is that the nerves from the bowel go up to the brain, that's the red, and the brain has the ability to send down signals to block the pain. Now, this system is called the gate control theory. And when the pain goes up, it's always experienced in the head, right? Pain is experienced in the brain. The brain can modulate it. So you can use hypnosis to block pain. You can use hypnosis even to make pain. So this gate is opened and closed based on what the brain is doing to block the signal. When we talk about disorders of gut-brain interaction, we're talking about dysregulation, where there's an increased signal of pain here because of injury or inflammation in some cases. Some cases there's no inflammation at all, but the brain is keeping that gate wide open so the pain signal goes up and you experience the pain. And this shows you some of the things that can affect it. Let me get a pen. the psychosocial context, pain beliefs, people who have had, we have patients who've had really bad experiences in the past having a lot of pain, and they take a medication and they have trouble with the medication because they've had bad experiences with it, and over time they can get conditioned to have maybe pain as a result of taking a pain medication. So this is a factor. Cultural factors, there are differences in culture. And then we have, with chronic pain, you can get this, oh my God, here it comes again. The pain is going on, and that could make you hypervigilant to pain and can affect your attention to it, and you might even start having negative or maladaptive thoughts. The other thing is, if you're depressed or anxious as a result of your pain, then that lowers pain threshold. There are lots of experiments that show that anxiety and depression lower it, and then you can have changes in the GI tract. This is very important because when we talk about the brain-gut axis, ongoing pain or ongoing stress, just like the post-traumatic, trauma, loss of a loved one, all of these things can lead to changes in the nerves of the GI tract. We call that neuroplasticity. And the nerves can actually thin out and deteriorate. And that could create a situation where intermittent pain becomes chronic pain.
Yeah.
The treatments that we have for that, like neuromodulators or behavioral interventions like hypnosis or cognitive behavioral therapy, can actually reverse that process. And there's studies to show that not only can you treat the pain, but you might rewire the system so that eventually you might not need to use those treatments over a period of a year or so.
Wow.
So that's the brain-gut axis. And it also applies for conditions like nausea and vomiting. Any type of GI function has its regulation with the brain.
Okay. Well,
Hope that's helpful.
Very helpful. Thank you so much. I appreciate that. All right, everyone. Well, I hope that was helpful to you to understand better what's happening inside of your body and how your brain and your gut are talking to each other and modulating or maybe not modulating the pain very well. So if you have any questions about what you saw about this brain-gut axis, we'd love to answer them for you. Write us a note on our Facebook page. We always get back to you when you reach out to us. So until next time, when we have a really special series coming up next week, and for I guess 2 weeks, a series of 2 weeks talking about trauma and IBS, really,
and how it affects GI tracts.
Right.
One other item, we are creating a schematic like this. We have a schematic like this, which if you contact Johannah, we can get this to you. If you're a clinician, the Rome Foundation is going to have a card that will be available at booths that show this brain-gut axis, so you can show it to your patients. If you're a patient, you can get it and look at it as well.
Exactly. Yeah, resource for everyone. So until next week, when we see you again, have a great weekend, and we'll talk to you real soon. Take care. Bye-bye now.
I know.